The Presbyterian Robert Wertheim Hospice House will be a landmark of compassion and care for generations of New Mexicans. As the first full-service hospice house in central and northern New Mexico, it will ensure that patients are treated with dignity, care, and compassion in a comfortable home-like setting as they reach the end of their lives.
My family is honored to support the Presbyterian Robert Wertheim Hospice House in honor of my father. He absolutely loved Presbyterian Healthcare Services. What was most important to him was about the patient and making sure that everything that was done within the system and the decisions that were made within the board focused on the patient and what was best for their care. He had a really deep affection for the work of Presbyterian and the work that everyone at Presbyterian did.
The vision is that we create a home-like environment for patients who are not able to receive home hospice care in their homes, as most people do. It's meant to be a beautiful building, warm and inviting. We're going to be having 10 bedrooms in it, each with a private bath. Rooms that are available for patients, but also for their families who can come and visit them. Sliding glass doors to private patios. There'll also be public spaces, a living room area, a family gathering area, an area where people can prepare meals, a dining space, and then a quiet space for prayer and meditation. All of this with the vision of something that would feel like a very welcoming, home-like place to be.
My husband, Tomas Galvan, was a patient at Presbyterian Hospital, and he was cared for by the Presbyterian Hospice team. Hospice is important for families because it gives the patient and the families an opportunity to, spend time together.
An important role that the hospice house can play is in the supportive care of patients so that family members get to be family and spend time with their loved ones, whether it's reviewing memories, looking at photos, just hanging out, a lot of gathering around food. Food is a memory for many people and something they can share also. Doing those things together is so valuable.
My husband was Hispanic, and so his sisters, they love to cook. Just reading about the hospice house, it's equipped with a kitchen and stuff, and I know his sisters would have just gone to prepare a meal for everyone, given that opportunity.
It can be a hard balance to play in hospice to be both caregiver and family. And it really is a struggle sometimes for families to be able to have both roles and fulfill them well. It can be of real value in a home hospice experience to do that, and many families really, really love that. But when there are crises in caregiving, what an opportunity to have a place where a patient can be cared for by our Presbyterian hospice staff and family get to be family.
I can honestly say that, I think those 5 days of caring for my husband physically, it was wearing on me. And, just my emotions too, I'm trying to keep everything together. And so the hospice house would provide enormous support in those areas, with the nurses, just to give the families time to refocus, to gather their bearings.
This will be something that adds so much value to our state and will be such a lasting gift to patients and their families in a time when they need it the very most.
With your help, we can build and sustain the Presbyterian Robert Wertheim Hospice House. Please consider a gift for construction or operations of this home, so that no Presbyterian patient is turned away because of their inability to pay, And patients and families will have comfort and support while they share memories and celebrate life.